good morning, everyone. So today we will be having a lecture on CGA and Frailty. So with me is our geriatric consultant, Dr. Kathy Usman, and she will be leading our lecture. And later on, I will also be sharing the screening process and the geriatric assessment process as we go along with the discussion. So for the information, everyone, let us all silent our screen first and listen to the lecture. For any queries or question, you may raise it after the presentation. So with that, let us start the lecture, and may we welcome Dr. Kathy Usman.
Yes, good morning. This is actually we'll be discussing about CGA and frailty, no? These are my objectives. I will discuss the overview, just give you an overview of CGA, what CGA is, when to use CGA, why do we use CGA, and some studies regarding the efficacy of CGA and who will benefit from CGA. I'll also be discussing about frailty syndrome and frailty indicator. This is just a short lecture. So for the definition, CGA is defined as an organized, holistic evaluation or assessment of an elderly. It is designed to determine medical conditions, functional and psychosocial capabilities of an elderly. So why do we use CGA? CGA is used because it will also help us in the development of plans for the treatment and follow-up, for the coordination of care. This is actually based on the premise that the evaluation of frail elderly using the CGA, when we use the CGA, we will be able to identify many treatable problems, and then proper referral will be made and coordination for proper care. And also, CGA is used to determine the need of long-term care and optimal use of healthcare resources. So the National Clinical Program for Older People now recommends that all older adults identified as being frail or at risk for frailty should have a timely CGA performed and documented. So CGA is now accepted as the gold standard for caring for frail older people. Kaya I included frailty syndrome as one of in my lecture. No? So who needs CGA? All older adults identified as being frail or at risk of frailty, they need CGA. Most meta-analyses have found that CGA leads to improved detection and documentation of geriatric problems. And the ability, although yung ability of CGA to improve outcomes such as when CGA daw is done, admission and mortality will also be improved, will depend on the settings where they have been implemented. Hindi lahat, in all occasions, in all settings, magagamit ang CGA. So, there were studies done in different settings with the usage of CGA at naipakita yung efficacy ng CGA. Sa different settings na ito, like performing CGA sa bahay when doing home visits, in acute geriatric units, post-hospital discharge, outpatient consultations, and inpatient consultations. Na sa home setting, studies have found that home assessment, when doing home visits, when you perform CGA, it is found to be consistently effective in reducing functional decline as well as overall mortality. In fact, may mga meta-analysis of 21 trials found that home visit programs were effective in reducing functional decline with an odds ratio of 0.64. Di ba alam natin yung odds ratio of less than 1 indicates decreased occurrence of an event. Therefore, it is useful in reducing functional decline when performed or administered to patients in doing home visits. It was also found that it can reduce mortality in patients aged 77 years below with an odds ratio of 0.74. Again, so it indicates decreased occurrence of an event. No? In acute geriatric unit, numerous studies have compared the effect of inpatient CGA with the usual care. So it was found out that patients who received CGA were more likely to be discharged to home and were less likely to be admitted to a nursing home even after a year after hospital admission. Although walang difference nakita in terms of yung functional activity and also sa cognitive status ng pasyente after discharge when doing CGA during admission in the geriatric unit. And it was also found out that CGA did not reduce the risk of death. So for the post-hospital discharge, CGA was done, itong post-hospital refers to the administration of CGA 1 to 2 days prior to discharge. And its purpose naman is to identify vulnerable patients, doing a comprehensive discharge planning and follow-up. It was effective in reducing rehospitalizations and emergency department visits. Ito, pag gagawin natin yung CGA 1 to 2 days prior to discharge, ito yung meaning ng post-hospital discharge. Although nandoon pa yung pasyente sa hospital. So I think this is worth mentioning talaga, no? Yung administering, doing CGA, the comprehensive geriatric assessment in the outpatient department. CGA has no benefit at all when done in healthy elderly. However, older persons with functional disability, urinary incontinence, falls, or depressive symptoms are likely to benefit from CGA. Ibig sabihin, they are less likely to develop functional decline, and they will likely develop better social functional activity and less fatigue. What is actually recommended in the outpatient as a screening tool is the 10-minute geriatric screening tool. And by using the geriatric screening tool, dito natin madidetect yung mga iba't ibang klase na geriatric syndromes, okay, which will be discussed by Dr. Zach later on. And remember again that doing this geriatric screening tool or CGA, once nalaman natin na frail nga yung pasyente and we decide to do a comprehensive geriatric assessment, it does not affect the mortality or survival rate. So let's go to the inpatient consultation. A meta-analysis of 29 randomized trials involving nearly 14,000 participants found that patients who received CGA were more likely to be discharged home rather than admitted to a nursing home. I think this is applicable lang sa mga ibang countries, no, sa Western, sa Europe, kasi sa kanila, after ma-discharge sa hospital, napupunta muna sa nursing home, no, or sub-acute care. So, who will benefit from doing CGA in the inpatient consultations? So, yung mga pasyente na may fractures or post-surgery because of fracture, failure to thrive. This is a new term for us. So, itong failure to thrive is a syndrome, one of the syndromes in elderly manifested by weight loss greater than 5% of baseline, yung mga chronically bedbound patients with decreased activity, decreased appetite, poor nutrition, and yung siguro matagal na bedridden, ito yung mga considered failure to thrive, no, mga pasyente. Patients with recurrent pneumonia, patients with pressure sores, immobility, and those who are 85 years old and above with dementia and immobility. they will benefit from comprehensive geriatric assessment when they are admitted in the hospital. So there is no standard criteria yet that is available to readily identify patients who are likely to benefit from CGA. Although may mga studies naman, pero sa ngayon, wala pa talagang standard criteria. But CGA is now accepted as the gold standard. Wala pang recommendation kung sino-sino, pero ito yung gold standard for caring for frail older people. So what is frailty? Frailty is one of the syndromes in elderly. It is a clinical state of increased vulnerability that is recognized by progressive multisystemic decline, reduced physiological reserves and ability to cope with acute stress, and increased adverse health outcomes. Ibig sabihin, ang mga frail elderly are those with multiple comorbidities such as cancer and other chronic diseases, plus yung impact ng physiologic decline in elderly. If you add them, no, physiologic changes in elderly or physiologic decline, plus the presence of multiple comorbidities, will increase the vulnerability of an elderly to acute stress. And the ability to cope with acute stress is less, no, compared to an older adult who only has yung mga physiologic changes sa katawan niya compared sa isang elderly na meron ng physiologic changes, meron pang mga chronic diseases. So, yung vulnerability, that makes them frail. Okay? So, hindi lahat ng elderly ay frail. Ulitin ko, yung mga elderly na may mga multiple diseases or chronic diseases, plus the presence of physiological decline because of aging is equivalent to frailty syndrome. Okay? Pero hindi naman lahat kasi meron tayong gagamitin na frailty indicators. So, if you have 3 of the 5 following present, no? 3 out of these 5, this is actually yung mga indicators for frailty. So, if you have 3 of these 5, unintentional weight loss, yung unintentional kumakain naman, pero pumapayat pa rin. And a significant weight loss is 10%. Ano yun? 10% ba yun? Can anyone, for the past 6 months, decrease in the body weight for the past 6 months, no? And then feeling of exhaustion, palaging pagod, maluya, weakness, slow walking speed, and low level of physical activity. If your lola or lolo or your mom has 3 out of these 5, these are the frailty indicators. Okay. So what happens when an elderly is frail? Palagi siya, the patient will experience frequent falls and injuries, progressive disability, and frequent hospitalizations. Yung palabas-pasok sa hospital. So CGA and frailty are actually related to each other. CGA, by doing CGA, you can identify and quantify frailty when used in elderly. You can also identify elderly at risk for frailty. CGA is the gold standard in best practice for managing frailty in older adults. And CGA determines the kind of intervention. Doing CGA, you will be able to determine the kind of interventions that is best for frail elderly. So CGA should be applied proactively in all clinical settings. For frail, tandaan natin for frail older adult at nalaman na natin kung ano yung frailty, no, in elderly. So it is the best intervention as well as preventive measure in managing frail elderly with complex comorbidities. I think that ends my lecture. Thank you for your attention.
Thank you, Doc Kat. So this is the second part of our geriatric hour for today, and I will be presenting the the screening, the
I will
comprehensive.
just uh, click the stop share.
Yes pa, Doc.
Okay, okay. Sige.